Sometimes when you have pain in the outer aspect of your elbow and you think it's tennis elbow, it can be other things. Aside from getting a history of injury, we physicians will look at your elbow using an ultrasound to help make the diagnosis. And we'll see tears where the muscle attaches to bone or where the ligament attaches to bone, or a combination of both. Hi, I'm Dr. Lieber from Regenexx Pittsburgh, your non-operative interventional orthopedic specialist, talking to you today about tennis elbow, which is lateral epicondylitis. So, for instance, it could be a pinched nerve coming from your neck that travels through that region, making it seem like it's tennis elbow. Or it can be other things, or it can be a combination of several things, making it somewhat difficult to figure out. We at Regenexx Pittsburgh are specialists in making diagnoses. We have the right background as musculoskeletal experts in physical medicine rehabilitation to make the right diagnosis. So in terms of tennis elbow, making the diagnosis is first based upon physical examination. Obviously, there's going to be tenderness in the area of the outer aspect of the elbow. But in addition, you want to rule out pain in other areas. So you don't want pain in the shoulder. You don't want to have pain in the forearm or the wrist. Typically, we'll rule out the diagnosis of lateral epicondylitis.
Sorry to interrupt Dr. Lieber. Hi, this is Dr. Adelsheimer. I'm sure you have a lot of questions or concerns. We want to answer these for you. Leave your questions in the comment section below and we will get back to you as quickly as possible.
In addition, there are certain maneuvers on the physical examination that make the diagnosis, such as extending the wrist, extending the fingers, or passively stretching the wrist downward. That also helps make the diagnosis. When you shake somebody's hand, if there's pain in the outer aspect of the elbow, that also helps make the diagnosis. So there are these physical maneuvers that can clue you into the diagnosis. And finally, a third part of making the diagnosis, aside from getting a history of injury or overuse to the area of the outer elbow, doing a physical exam, we physicians will look at your elbow using an ultrasound to help make the diagnosis. And when we do that, we'll see tears where the muscle attaches to bone or where the ligament attaches to bone, or a combination of both. And that will help make the diagnosis of tennis elbow or lateral epicondylitis. So with respect to healing of tennis elbow, sometimes tennis elbow will heal on its own if you rest and stretch the area and don't overuse it. But it can become a chronic condition after a couple months where, say, you're playing tennis routinely or doing physical activities that stress where the muscles attach to the bone on the outer aspect of your elbow. And in those instances, it really won't go away on its own. The traditional treatment, aside from physical therapy, is to do cortisone injections into the area. Unfortunately, the cortisone actually is more harmful than helpful. You can get temporary benefit from the cortisone shots, but more often than not, you'll develop atrophy in the soft tissues and weakening of the area where the muscle attaches to bone with even one cortisone injection into that area. So it's important if you're having chronic lateral elbow pain, tennis elbow, to come to an expert who has experience in treating this in a non-surgical way, because for virtually all people, surgery is unnecessary to treat lateral epicondylitis. We physicians at Regenexx Pittsburgh all have an expertise in musculoskeletal, non-orthopedic treatment. We're all board certified in physical medicine and rehabilitation and have board certified specialties in musculoskeletal care to make the right diagnosis and then to help you along the way of treatment. And what we typically will wind up doing is to treat your tennis elbow with platelet-rich plasma. We refer to that as super concentrated platelets, where we take your blood, spin it down, and get the platelets, which have healing growth factors, and inject them into the area where there are tears under ultrasound guidance. So we're putting your platelet-rich plasma where it's needed most. We then will rehabilitate you over the course of time with exercises and or physical therapy to restore your overall function, ideally to where you were prior to having the pain in that area. The tears should get better, as should the tears in your ligaments and your tendons. So if you're having a tennis elbow issue or any musculoskeletal issue for that matter, feel free to reach out to us at regenexpittsburgh.com. We're responsive to you and we'll get back to you quickly. And as is the case for all evaluations, you're going to be evaluated by a physician who understands your condition, can make the appropriate diagnosis, and can get you on your way to better function and pain reduction. You will not see a physician's extender, such as a nurse practitioner or a physician's assistant. You get the physician every time. So please reach out to us at regenexpittsburgh.com.